For 28 years, Indiana Health Center at South Bend has stayed where the need is greatest. They've succeeded because they listen to the community they serve. They have a financial plan that works for anyone and convenient hours to match, Monday through Saturday, including 3 evenings. And Indiana Health Center doctors are on call 24/7, 365 days a year.
I've been coughing up phlegm for a couple weeks. And
IHC understands the needs of people and the language of affordable health care, from setting up an appointment and assisting with Medicaid applications to working with private insurance or providing health care on a sliding fee scale. It's also accessible, consumer-governed health care that's convenient. This urban stretch of South Bend is home to working families and many cultures. Its neighborhoods have housed waves of immigrants over the years. It's also home to the homeless and home to one of the most ethnically diverse populations in the state of Indiana. But Indiana Health Center doesn't see statistics. It sees people. People like Danielle, Willia, John, Julissa, Jesus. To each of them, Indiana Health Center proves we're in your neighborhood. We're here for you. 2 years ago, when Jesus Navarro needed a kidney transplant, Dr. Toper's intervention was life-saving and life-changing.
I'm very grateful because if it was another doctor, he wouldn't have done as much as Dr. Toper did. And Dr. Toper took his time and, and effort. And I thank him a lot for that. He's the reason I'm here.
Since 1979, IHC has been a medical home base for those who need medical care the most. South Bend's children, its families, the elderly, the homeless, farm workers, and those who are uninsured and underinsured.
Julissa, ¿qué comidas te gusta?
The staff speaks English and Spanish. That means these full-time, board-certified physicians, dentists, nurse practitioners, nurses, and staff really connect with patients, providing quality, affordable medical care with respect, understanding, and compassion.
Adios.
Medical Director Dr. Zia Toper says this is old-fashioned, personal, committed medical care.
I know I can make difference in my patients' lives, and they appreciate it so much that the smile that I receive at the end of the visit is my reward.
A one-stop medical facility handling 35,000 patient visits a year, Indiana Health Center still remembers to care for patients, one person at a time. Community member Willia Sanchez knows how important it is.
If it wasn't here, there would just be a lot more sick people. The emergency rooms would probably be overflowing. And it's just something that we are extremely blessed to have in this community.
Health centers are where the patients feel like they need to be. They're open when the patients feel like they need to be open. And they provide a range of services that are unique for the patients that have difficulty accessing health care.
Wendy Lacona's baby is due in 6 weeks, and she has no insurance.
She said that she knows that by her sister that she was treated very well in our clinic. And she thinks that her baby is very important to her and her prenatal care is.
Less than half of Indiana's pregnant women get adequate prenatal care. IHC works to improve those statistics, one new mother at a time. The total care of the patient is the mission here, both medical and oral health.
We're going to have you out of pain in no time.
In the dental suite, a staff of 9 handles appointments and emergencies.
He's going to need to pull out the teeth because I feel terrible.
The dental service opened in 2002 with 2 dentists, 1 hygienist, 3 dental assistants, and a lot of TLC.
Do you like my hair? You don't like it? Why not? It kind of looks like yours.
For Dr. Tom Allen, serving his dental patients is a personal mission.
My greatest enjoyment in this clinic is teaching people that getting dental treatment can actually be fun. Nice job. You did so good today. I suppose at this point in my life, my greatest joy is taking care of the dental needs of people who can't afford it.
More than half the patients seen here in the clinic are children. Many have never seen any other medical provider. South Bend has some of Indiana's highest child poverty and teen pregnancy rates. 1 in 7 South Bend residents live in poverty. 1 in 6 children in this city live at or below poverty. And in Indiana, more than 1 in 5 children under the age of 2 go without basic immunizations for hepatitis B, mumps, measles, and whooping cough. Manufacturing here has declined, but the area is working on a resurgence. This is still a proud neighborhood with its own identity. For thousands of families in South Bend, this health center has always been here to fill a void.
While we're not a free clinic, we do offer a lot of different services for patients that have Medicaid, Medicare, commercial insurance. For patients that don't qualify for any of those, we offer a sliding fee scale that goes along with the federal government's poverty guidelines, so we can basically see any patient that would fit any of those criteria.
Can you open up your mouth?
Indiana Health Center's Project Homecoming serves the homeless community, including veterans and children. John Carver knows about patient loyalty. He's been coming here for 9 years.
Everybody needs health care. Everyone needs it.
With more than 4,000 annual patient visits, Project Homecoming is a consumer-governed practice. It accepts Medicaid and insurance, waives fees for those at a poverty level, and never forgets its roots.
You don't know why they're homeless. You don't know where they came from. You don't know what happened to them this morning. You have to approach every patient as a person, period.
Indiana Health Center has served generations of families and will serve generations more. There is a reason this is the longest-running neighborhood health center in South Bend. The doctors, nurses, and staff at Indiana Health Center know their mission. They are dedicated to being here for this community, here with resources, responsiveness, ready answers, and a friendly smile.